Okay, everyone. So we'll begin, and if other people enter, then they will just join us. So good afternoon, everybody. I'm Warya Tishby. I'm president of the EU chapter of the Society for Psychotherapy Research, and I'm really, really excited to introduce Dr. Harold Chui, and thank you for agreeing to give this webinar. Harold is associate professor at the Department of Educational Psychology in the Chinese University of Hong Kong. He's also co-chair of the Diversity, Equity, and Inclusion Committee of SPR, and also, of course, president of the Asian Area Affiliate. Harold has broad research. I told him before that my PhD students cite him a lot. He focuses on therapist factors, specifically therapist emotion, but on other psychotherapy process and outcome issues, and of course, multicultural issues. So this is what I was interested in for today's webinar, and the title is Developing Culturally Responsive Therapists, the Role of Peer Relationships in Training and Supervision. And we'll go for about 45 minutes. So if you have any questions, please put them on the chat, and then we'll have some time for discussion until 5 o'clock in Israel and whatever time it is, wherever you are around the globe. So Harold, please.
Yeah, thank you so much for the invitation. I'm really excited to share some of my thoughts with you and some of my research as well on this topic. So maybe I can share my screen right now. Okay, can you all see? Okay, so just want to have a proper greeting. So good morning, good afternoon, and good evening to people from all over the world. So this really speaks to the diversity of our audience and the SPR membership. And when we talk about cultural diversity or diversity issues, it can mean very different things across different parts of the world, and or at least have different emphasis. So for example, when I was training in the US, when we hear about cultural diversity, there's a lot of focus on racial and ethnic diversity. And there's also a huge literature in the psychotherapy research area on sexual orientation and gender diversity. Whereas right now, where I am in Hong Kong, there is a lot more homogeneity in terms of race makeup of the population. So most of us are ethnically Chinese. But when we talk about diversity issues, there's a lot of emphasis on socioeconomic differences. There's also a lot of emphasis on neurodiversity in recent years because there's a lot of resources channeled from the government and the education departments on helping students with special educational needs concerns. So, for example, students with autistic disorder and on the spectrum. And so wherever we are really have a determination or influence how we think about diversity. So I just want to acknowledge that whatever I'm presenting is really just one perspective, and hopefully you can take away from tonight's talk and walk away with something from the talk that you can apply to your own setting, whether it is training or practice or supervision. So to give you an overview, what I'm going to talk about tonight or today is on peer relationships in psychotherapy training. This is an area of research that I've developed since I was a graduate student. And then I'm going to go over some models of multicultural training, focusing on competence-based models as well as process-based models. And then I'm going to focus on one study that was recently published on perceived cultural humility in supervision group and its impact on training outcomes. And finally, I'm hoping to leave you with some training implications as well as some caveats when we try to talk about cultural issues in the classroom or in group supervision. some of the ethical challenges that we face as educators and trainers and supervisors. So to start with, in terms of the role of peers, it's not really just about psychotherapy training. When we look at the psychology literature more broadly, role of peers have been studied in learning. So for example, in developmental psychology or in educational psychology, there's a lot of focus on peer-to-peer learning. For example, imitation. So children and teenagers will imitate each other's way of speaking. There's also discovery on engagement within the peer group in discussion, and that really help children learn as well. And finally, when we look at the cognitive psychology or educational psychology literature, when peers learn from each other, or when peers teach things, when they try to explain things to each other, it actually enhances their learning. So for example, if you need to tell someone about a complex concept, you need to know it really well before you can convey that in a clear and organized fashion. So having an audience, so for example, a peer in the classroom that you are teaching to, really helps you in the learning. So besides developmental psychology and educational psychology, in industrial organizational psychology, there's a lot of research on colleagues relationship. So quality of peer relationships at work has been associated with many job outcome variables. So for example, job satisfaction, whether you're happy going to work each day. There's also association with job involvement or commitment to the organization. So if you find people who are on the same frequency as you, who are your co-workers, you tend to be more involved and more committed to your job. There's also the moderating effect of peer relationship on burnout. There's boosting of morale as well as improvement in job performance, especially if you are doing teamwork. So if you are working as a team on a certain project and you like your peers' tendency is that you will turn out to come up with a good performance. So bring it back closer to psychotherapy training. It is really both a combination of learning and work. So you go into the classroom, learn about theories, you practice helping skills, you are really working because you're working with clients on a day-to-day basis. You bring, case conferences, talk about your cases. This is like a work meeting. So this is a combination of both learning and work. And when we look at who goes into psychotherapy training, we are really looking at people who tend to be quite interpersonally oriented. So hopefully you have students who are interested in people. And the flip side is that we as psychotherapists are pretty much affected by the quality of the peer interactions that we have day to day. So if we interact well with some of our peers, that day seems to go more quickly and is more enjoyable. And whereas if you have a poorer peer interaction, that becomes something that you ruminate or even keep you, become more hesitant about going to the next class, for example. So I think this is something that we really want to capitalize as trainers, to really look at peer relationships. There's a lot of literature on supervisory and supervisory working alliance, but there's so much less literature on peer relationship. So that was one of the impetus to do a project. And this is a publication 12 years ago, and it was a study done when I was a graduate student. And so give you a little background about this project. I was a second year PhD student at the University of Maryland. And having gone through the first year, I had an experience with a group of peers. So in my cohort, there were 7 of us. 6 of us were very close, and there was one person who seemed to struggle a little bit with different parts of the course, different in answering questions, in the group dynamics. So in that year, in my first year, there was a lot of experiences that were sort of an imprint or marked in my brain. And I thought that how I experienced PhD training as a counseling psychologist really was shaped by my peer interactions. So I brought this idea to my supervisor then, Dr. Hill, Dr. Clara Hill, and then she thought it was a good area to explore a little more. And I got in touch with my cohort mates. So as you can see here, Catherine and Beatrice, they were actually my cohort peers. And we started a project on peer relationships in counseling psychology training. So for those who are students in the audience, perhaps you can really examine your own experience in your training and come up with new research projects this way. So in this particular project, we recruited 12 doctoral students in counseling psychology all across the United States. And we asked these students about their experiences with their cohort peers. So we asked them specifically about their experiences in the classroom in terms of their clinical work interactions. So for example, if they have case conferences or if they have group supervision. We talk about their experiences with research classes, doing projects together, writing papers on submitting abstracts to conferences. We also ask them about work interactions outside of work. So for example, social settings. And secondly, we also ask them to compare and contrast their peers with clinical supervisors, research advisors, as well as friends and family, to say a little bit more about what they get from peers that they're not really getting with supervisors or research advisors and families, friends and families. And besides the qualitative interviews, we also invited them to complete a measure of peer relationship scale. So this is really a graphical representation of the closeness with their cohort peers. So to give you a sense of what they actually completed, this was the peer relationship scale that was given to the 12 participants. So before the interview, they were given this scale and they were asked to put in circles that represent their cohort mates onto this field here. So the black dot here represents them, the participants, and then we ask them to place the cohort peers onto the circle. And to give them a bit more guidance, we have concentric circles here. So if someone you consider very close at the level of intimate level, you can put them closer to you. And then if it's moderate, you can put them between intimate and moderate. And then if it's further apart, this is called distance, right? And then, so we give them and they are supposed to put their peers onto this circle. And so to give you a little bit more of background and context, we ask only PhD students. So these are small programs and they are supposed to put in cohort peers. So peers who entered the program at the same time as they did. And so in the US context, it's typically between 4 to 8 students. So here is one actual example of response of our participants. So we call this participant Mary. So Mary had very good relationship, as you can see from this diagram. She put all the peers, 6 of her peers in this intimate circle, and one of the peer a bit further, but still within the moderate level. So closer than moderate. So what we did was to use a ruler and measure the distance between the self and each of the peers, and then calculate the average score. And this is the average score or the peer relationship distance for Mary. And we did this also for the rest of our participants. And people like Mary tend to talk about these things here. So impact of good peer relationship on training. So what Mary and people who have very good peer relationship talked about how they were able to share ideas freely without worrying about being judged. They talked about how they kept one another informed about opportunities. For example, if they have clinical placements, if they have assistantships that they need to compete for, even though they are competitors in the technical way, they are still able to talk about it and share resources. And finally, and I think this is quite important as trainers, cohesion among peers really strengthen the commitment to the profession. So these students are in their second or third year in their programs, and they are still developing their professional identities. And when they had really good peer relationships, they talked about how they would enjoy going to conferences together, work on projects together, and also even envision being friends after the graduate program. So these are good things in terms of having people who want having people to commit to their profession and try to contribute a little more to the profession. So we also had students or participants who had poorer relationships. For example, Susie here, when we asked Susie to put her peers in this universe or the field here, we found that the 5 peers that Susie put was actually quite far. So almost 4 of them, 3 to 4 of them, 1, 2, 3, 4 were outside of the distant circle. So the third circle is distant. And only 1 of them is between moderate to distant. So Susie really struggled with the relationship that she has with her peers. So the representation here show a very distant relationship. And when we consolidated data, we found that the impact of peer relationship on training were quite significant. So for example, Susie and her other participants said that there was this kind of competitive energy trying to give the right answer to the faculty member for every single question he or she asks. And to the participant, it is very not so productive and not as enjoyable. And I remember some of the participants also talked about how they would be hush-hush. They don't want to say too much about how they want to, whether they are graduating on a fast track, whether how many papers they are working on. They don't want to talk to each other about that because they feel a bit more threatened when they are not on very good peer relationships with the rest of the cohorts. And then in terms of the classroom interactions, students talk about how when some people have negative energy, it kind of put everyone's guard up when you start feeling that way, and it definitely limits their ability to get to know people well and feel safe and let others get to know me as well. So it is both not being able to disclose, but also not feeling like others are disclosing to them. So there's a big wall here. And you can imagine how that may look like when we are dealing with psychotherapy training, where there's a lot of discussion of, say, countertransference reactions. It delves into some of the personal background. And when peers are not doing so well in terms of their relationship, the discussion tends to be more superficial because no one felt safe in opening up. And when we talk about multicultural issues, this gets even more personal. One participant talked about how the multicultural course was a disaster because of the self-disclosure component. And some peers flat out refused to do some of the assignments. And one example is that the participant gave was how people would comment on each other's values. So one particular comment was, "Oh, this is I don't think anyone should be marrying at such a young age." And that comment really flustered the participant and make her feel like there's no place for her to speak truthfully about what her plans are and some of her values because of the passing comments in the classroom. So here we are with this based on the comments and on the data, we come up with this particular model. So when we are in a cohort or in a group supervision setting, when the quality of peer relationship is good, it tends to promote trust and safety in the learning environment. And this trust and learning in the learning environment would improve their self-disclosure and increase the depth of the discussion. And this will continue to feed back to consolidate or reinforce the peer relationship quality or the strength of the relationship. And on the flip side, if the peer relationship is weak, it tends to undermine trust and safety and tends to discourage self-disclosure and depth of discussion. So you can see this cyclical pattern, or this how this will really set up for how much trainees can get from the group discussion, from supervision and the classes. So moving on a little bit to the role of self-disclosure in multicultural training. So historically, multicultural training really focused on the development of cultural competence. So back in the 1990s, there's a lot of focus on cultural competence model, which focuses on knowledge about specific groups, specifically other groups, as focus on skills and interventions that are called culturally adapted. So they are focusing on the needs of others. There's focus on awareness of one's biases towards other groups. And to train knowledge, skills, and awareness, there's a lot of focus on didactic lectures. What are other groups like? There's case analysis, give you a case scenario, a particular client population, and there's a lot of discussion about systemic issues and some of the vulnerability factors in particular groups. There are some role plays. How would you work with let's say people who are socially disadvantaged, maybe racially or socioeconomically. But there is the downside of this kind of training because there is an illusion of mastery over another's culture, that we are, this dominant group of therapists coming from more highly educated mainstream or majority culture is mastering the minority group's culture. And at the same time, it sometimes reinforces stereotypes because there's a lot of emphasis on, do we know enough of the other groups? So in counseling and psychotherapy, there's now a push to shift the focus to more on cultural humility, where it is focused more on the attitude and the lifelong process of self-reflection and self-critique. So we are not only learning about other people's culture, but really starts with examining my own culture and beliefs and identities. In the definition by Hook et al., there's a maintenance of an interpersonal stance that's other-oriented. So being open to the other person in relation to aspects of cultural identity that are most important to the client. And when we look at how we train people to be culturally humble, we really are encouraging people to do more self-reflection. So perhaps in their self-reflection journals, when they're writing notes about their interactions with clients, they can be doing process notes for themselves. And we also focus on disclosure and discussions of cultural identity and experiences and biases. And that's where this is self-disclosure in courses and group supervision come in. So to give you a little more background about cultural humility, so it is actually a term derived in the 1990s from medical education, when they focus more on how do physicians or family doctors tailor their interventions or tailor their care more specifically for disadvantaged population or culturally diverse populations. And it is gaining traction in psychotherapy research in recent years. And to give you even more background, it is really a foundation of implementing what we call multicultural orientation, which is really a way of being. If you see multicultural competence is a way of doing, then multicultural orientation is a way of being with clients, guided by the therapist's philosophy and values about the salience of cultural factors in the lives of clients and therapists. So for example, in Hong Kong, there's a lot of academic pressure And this is the culture that school children live in. And they have a lot of the pressure that comes from the cultural or parental pressure to succeed academically. And if they don't do so well academically, there's a lot of stress in them. There's a lot of anxiety. What are the alternatives if they don't go to universities? So this is just, acknowledging the therapist being able to acknowledge that the value of the culture and can impact on clients' well-being. And so besides the practice of psychotherapy, cultural humility is now also integrated in the practice of supervision, where supervisors try to model cultural humility, where there's emphasis on acknowledging what the supervisee is experiencing, acknowledging the differences between supervisors and supervisees during supervision interaction, and also encouraging the trainees to participate in culture-related activities. So for example, being able to connect with culturally different groups, to read more about others, to learn more from interacting with them. So for example, going to a Black church for a white person or an Asian person. They also do something called cultural genograms, where they map themselves onto different cultural identities and how these cultural identities influence their own worldviews and values, and how their own values will then impact the way they see their clients. And so the research is pretty clear that when supervisor is exhibiting more cultural humility as perceived by the trainee tend to rate the counseling self-efficacy higher, the supervisory alliance is better, supervision satisfaction is also better, and there's also less intentional non-disclosure during supervision because they feel that the supervisor is ready to accept or hear the supervisees when the supervisors are exhibiting cultural humility. And so the question for us here for today is, how can we use the group to is there such thing as group cultural humility? And how can we use group cultural humility to influence training? And so we did a research project on group cultural humility, and I'm going to share some of the findings with you today. So this was a paper that was published in last year in Psychotherapy, and this was done in Hong Kong, and the title is Perceived Cultural Humility in Supervision Group and Trainees' Cultural Responsiveness, Self-Efficacy. So here we recruited 2 programs. So my collaborator at University of Hong Kong, as well as my university at the Chinese University of Hong Kong, we asked 91 students doing their practicum training in counseling, who are also involved in 18 supervision groups. And so these 91 students were in 18 supervision groups, approximately 5 students per group. They have supervisors, and we asked them to fill out a bunch of questionnaires and to assess their cultural humility and other variables in their training outcomes. So to give you a sense of what happened, so there is group cultural humility. So group cultural humility, we define it as what the trainee perceive from the supervision group members. So for example, the trainees were first asked to identify up to 3 aspects of their cultural identities. So for example, age, gender, sexual orientation, their religion, their race. Choose 3 that is salient to them. And then we asked them whether they thought that group members were respectful or open to explore or genuinely interested in learning more about these aspects of their identity. So this would become the group cultural humility score for that trainee. And we also asked trainee to rate their level of cultural concealment, which is really the concealment of cultural information about themselves. So let's say if they come from a disadvantaged background because of their family income, or they talk about their clients' specific areas of their culture that they do not tell the supervision group because they sense some kind of prejudice or bias. So that would be considered cultural as concealment. So if you look at the result here, group cultural humility, when a participant or trainee perceive higher group cultural humility, they tend to conceal less, both in terms of their own identity as well as the client's identity. Okay, and then another variable that we asked was socio-cultural awareness. Here is the level of awareness of how the interlocking systems of power and privilege impact individuals from diverse backgrounds. So as you can see here, when people perceive more group cultural humility, they tend to have a higher socio-cultural awareness as well. And what is really important or most interesting for us is this mediating role here, where when a person has better social cultural awareness, this also improves their cultural responsiveness, self-efficacy, as defined by two of these things. So cultural responsiveness, self-efficacy refers to self-efficacy in identifying structural or cultural factors in treatment, as well as the self-efficacy in managing counseling relationship conflict, mostly due to differences between themselves and the client. So as you can see here, when there's a group cultural humility is better, improves social cultural awareness, improves cultural responsiveness, self-efficacy as well. So when we look at these results, we want to think a little bit about what is happening here. So the first interesting finding, or the lack of, or the reverse here, is when we have better cultural humility in the group, likely increase the sense of safety. And so there is less of a need to really conceal cultural information, right? So secondly, when there's greater humility or cultural humility in the group, it may facilitate greater conversation about cultural and structural issues in the group supervision context, and that may help students to improve their social cultural awareness. And what is most interesting to us is the mediating factor that is observed for social cultural awareness, but not so much the concealment, cultural concealment. So it appeared that decreasing in the decrease in passive concealment is not enough in enhancing cultural responsiveness, self-efficacy. But instead, there needs to be some kind of increase in social cultural awareness, perhaps through more active broaching about the subject, active discussion about cultural contents that is needed to increase cultural responsiveness. So this is some of the takeaway that we have. It's not enough to not hide about cultural information, but there's a need to actively bring up, and there's some way to do it. I think that brings us to the next part here. When we talk about the quality of peer relationship, improving trust and safety and self-disclosure, maybe we don't only focus on peer relationships per se, but we also should look at the group in allowing students to do that in a culturally humble way. So there's the group cultural humility factor in the group climate context, and also in terms of the self-disclosure and perhaps cultural disclosure and discussion here as well. So this is the research part. So now bringing us to the next part on training implications. So this is one of the real interventions that we often use in cultural, in training. This is called the wheel of power and privilege. It is really an exercise where students are asked to map their various identities, whether it's race, gender, religion, or SES, and reflect on their associated privileges and disadvantage. I really like this circle because in the center, it is the power, right? So power, if you are powerful, if you are white, citizen, cisgender, people who are rich, who own property of a certain body shape, etc. And whereas those who are in a more marginalized, so for example, who are darker skin, undocumented, who have different gender identity. And so this is all the different dimensions that students can map themselves on and see where they fit in terms of power and privilege and disadvantage. But one really important thing here is that this is well developed in Canada. And so there's a lot of context to this, and what is considered powerful can be different across places. So when we use this circle in China, we will adapt it and change it in a different way, because power is no longer about being white. There's who is the majority race, for example, would be the more powerful. So when students are asked to do this, we need to be careful as well, because it gets heated sometimes because we are talking about very personal things. And whenever we involve students to reflect on this and do self-disclosure and discussion, there is heightened emotional intensity in the room and perhaps sometimes stress among trainees, both for those who are more vulnerable when they are discussing experiences of discrimination. For example, if they are in the minority group, whereas most of the classmates are in the majority group, they may feel vulnerable. But at the same time, those in the majority position, they may feel defensive and perhaps guilty as well there when we are discussing issues around privilege and power and biases. So next, we also want to be careful about blurring of professional boundaries when it touches on how we, especially in group supervision situations where we are working with an actual clients, and when we use supervision to examine some of our supervisees' biases, it can also be difficult and get personal because we don't want to delve too deeply into the background, but we know how the cultural factors are seriously impacting the way they are seeing the clients. And then it comes into confidentiality issue. In individual supervision is a little easier because it's just between supervisor and supervisees. But when you have a group situation, when you have a class situation where students may meet across different contexts, across different classes, join different research projects, meet students from other cohorts, then it gets into muddy waters. What is confidential? How can we protect students who disclose in the group setting? This is something that is important to be aware of. And finally, we also want to be acknowledged that instructors' biases and instructors' worldview will have an impact on how we define and how we discuss multicultural concepts. So who are the excluded and excluded or included versus excluded groups? What is the composition of the student body in the classroom, and what gets discussed or stays silent? As we talked about how sometimes what is not talked about is not enough. It's important to reduce the number of things that we do not talk about, but it is also important to increase more active discussion. So sometimes we, on the flip side, is that when we have a composition of students who are really coming from majority groups, and then you have no representation from the minority group, then it's almost like talking about as opposed to really gaining an understanding that would actually reduce the stereotypes. So these are some caveats when engaging students to use cultural disclosures in courses and supervision. And finally, take us back to improving peer relationships. I think there's a lot of literature on how we do multicultural education, but there's not enough spoken about how we do peer relationships in the classroom, or making sure that we take care of group dynamics in the group supervision situation. So looking at the literature, there is some guidance. So for example, in this group psychotherapy literature, it is important to establish the desired group norm early. So it is good for instructors to pay attention to what is the group climate like among the first year students, or within the first couple of months of your group supervision or in your courses. What are they talking to each other, or are they really acting really politely? Are they able to challenge each other in a authentic and honest ways? So this is something to think about. Next, we want to convey some expectations about participation, and it is important to not just encourage participation from everybody, but really also set boundaries, because there are very vocal students in each year, and they may take away some of the opportunities for those who are quieter to participate. So it is like a dance in the classrooms. If someone is speaking all the time, then we need to maybe request that students give other students a chance to speak. So this is really on the onus of the instructor, because this group dynamics really need to be intervened early so that everyone can participate. I use some ice-breaking activities. So for example, at the beginning of the semester, where in a class of 45 students who are master's students in counseling, 45 students, I usually ask them to talk about where they actually live, so that they can get a taxi to go home together after class, or if they are rushing to class from work. So these are part-time students, so they need to come to campus from their workplace. So I ask them to talk about where they work, and to get into a taxi together. So these are really good activities to actually get them to start talking to each other. And also facilitate conversation and model healthy conflict resolution in the classroom, as well as supervision groups. So secondly is really to think about reflective activities, not just about multicultural issues, but also about their own experience in courses. So in my universities, there's a lot of midterm evaluations that students give to the instructors. But most of these evaluations focus on the course, focus on the instructor's delivery of the course, but not so much about the peer relationship. So the encouragement here is to perhaps to get your students to think about their peer relationships, maybe completing a peer relationship scale, or even thinking out loud about their experiences with peers and whether they're getting what they can potentially get from their interactions with peers to facilitate their own learning, their own reflections about psychotherapy in the classroom. And finally, so in some years, we will probably have what we call problematic students, or students who give instructors a headache, not just instructors, but perhaps also to other students, where students find it difficult to work with them or tend to be excluding this particular peer in the group. So problematic peers contribute significantly to trainees' stress and dissatisfaction in the training. And so in some of the literature, instructors are really encouraged to address this early, and trainees really appreciate instructors who actually intervene and engage all the others to participate in this conflict resolution, to have a voice to really address this issue, so that the peer dynamics, the group dynamics can be improved, and potentially improve the ability to learn from the group. So I think that's all that I have so far. I'm really, really looking forward to your comments and questions. And I think whether you are a trainee or an instructors or supervisors, I think this is something that affects all of us. And I think we can have a discussion about this.
Yeah. Well, thank you, Harold. This was terrific, and you got it all, compact and on time, and so much information. I think if we want to see each other in this group, maybe we can stop share. I hope everyone saw your email. So we can stop share, and then people can just raise their hands and either use the React or just raise your hand. And we have like a little less than 15 minutes for discussion. So any comments, questions?
I think we can all reflect on our experiences being instructors.
Yeah.
Some years the peers are so close and they have such wonderful relationships. But some years are difficult. They seem to be just getting into class and then leaving and not really interacting beyond. Sometimes moves, sometimes challenging. So we'll see.
I see that someone wanted to see the source of Rowe et al. Paper, if you want to put it up on the chat, and then we can, the 2008 paper.
Yes, I can.
Okay.
I will do that in the chat. Yes.
Yeah, Ivana, thanks for raising. Yeah.
Yes, someone's gotta go first.
Absolutely.
A spontaneous candidate for that. I just wanted to kind of express my gratitude that such plethora of diverse and then continuous identities can be embraced now. So we kind of can escape stereotyping, because from time to time, skill kind of a targeted models really tend to do that. So inclusiveness that you expressed was such a relief and freshness in the air for this specific sector. So I thank you for that.
Yeah. I'll take you up. When you said before, someone's got to go first, that linked to my question, because I also have multicultural classes or groups. And, I introduce and I've said, let's start talking. And there's always this silence and everyone is waiting for someone to begin. So what do you do with that, Harold? How do you get it going? I mean, I like the idea of asking them where they work and where they live, because that's a non-threatening kind of question. But when we get to deeper issues, how do how do we encourage people to start talking?
I think one way is to do some self-disclosure myself. I think that will lower the power dynamics too in the classroom. So when we think about multicultural, we often think about power, and the instructor and supervisor usually holds the most power. And by lowering that a notch, and that can really help students to start talking more. I think some self-disclosure, some sharing some of my experiences as whichever that identity you feel comfortable sharing, that can be helpful.
So sensitive.
Another possibility is to encourage students to get into pairs or a group of 3 or 4 students. And that way they also are forced to talk, because some students may not feel comfortable speaking in the classroom, but when we throw out good questions, students tend to talk among themselves. So that gets over the awkward silence sometimes. Yeah. Especially in Chinese context, students tend to be a little shy at the beginning. So I usually encourage students to talk among themselves and then try to, volunteer someone in the group to report back to us. So that can be, a humorous way to start the ball rolling when you want to get back to the big group discussion.
Okay. Other comments, questions, clarifications?
Maybe I can just step in with one comment, which I really liked. I wish that I'm at the beginning of my training, but I'd wish that we'd had that discussion in the group about that it's not the responsibility of the lecturer to ensure that we have good learning. It's a co-responsibility of each and everyone in the room, and that we're all responsibility of the quality that we can as a group achieve. Because I understand that it of course is voluntary what you share and how you share it. But if there is this opening discussion about that we're all sort of codependent in terms of how creating quality together, because we all want to learn together, then that might take some of this inhibition away, possibly. So I really like that. So thank you very much. I really enjoyed your presentation.
Okay. That's
really setting the tone early really helps, because once you get over the second or third classes, the norm is pretty much set. And if it is quiet in the second or third class, you tend to be it's difficult to get the ball rolling again, or disrupt that dynamic.
Yeah. Okay, this is a great question. If you want to repeat, when the training environment is very homogeneous, can you say something about that? What may happen?
Do not end up talking in a way that is othering. That's a really good example. Good question. I think it is.
I mean, I'm not sure who are the others, but I can imagine from my experience that somebody has a client from another culture and the group is all from the same, and we're talking about that client's culture. And so we can feel pretty free, if we want to pass judgment, because we're talking about the client. And so I don't know if that's the issue or anything else is the issue, but that's a situation that comes up often, where the client is the outsider. And
yeah, I think in one way is to perhaps to ask the group really honestly, what do they know about that group? So for everyone to be able to say something, because we may assume that, nobody has that experience, but maybe they do know somebody. Maybe it is a friend, maybe it is a family friend that they have, and that could be one way of starting the conversation. And the fact that nobody is in the group is actually quite something, right? So it shows how there's a great need to be humble, because nobody has any knowledge about the particular group that we are trying to understand. And so it goes on to speak about how sometimes who gets into graduate school, who gets into psychotherapy training, and that is also a learning opportunity. So in multicultural orientation, we don't just talk about cultural humility, we talk about cultural opportunities. So this is an opportunity to use so that we don't miss out on the fact that, wow, nobody in the class actually have any experience with this particular group.
wow.
So how much more important it is for us to think together, how can we really know that group when none of us have personal experience? So could it be volunteering in a particular, let's say, shelter, or going into a particular setting so that you actually get to know someone from that group? So brainstorming what we call cultural opportunities and not missing those.
I wonder, Harold, if you know anything about the class differences, and I can understand like your example with the shelter, like going down in class is sort of easier. But what if you work with a client of a higher class than you are? I guess I'm wondering if that's ever been examined.
And then it speaks to maybe countertransference reactions, really, about being with someone who seems more well off than you, and what it means to my why is it an issue for me in the first place? How I see money, how I see privilege, and I think that is a conversation to be had. I mean, with your supervisor and potentially with your class peers as well.
I mean, I see this nice comment. Will there be a following meeting that explores deeper? Maybe we could do something spontaneous in Osaka. I don't know. Let's think about it. Maybe.
Yes, we do have some discussion sessions on this.
Yeah, I'm saying in addition, if there's anything specific, and if not, we might do something spontaneous.
Yeah, to share experience with instructors. And I really like a comment, Ivana, about what part of your story feels more present for you right now. I think that is something that also speaks to the cultural opportunity, the moment-to-moment comment that sometimes we miss as well.
Yeah. Well, I think we have time for one more comment.
And hybrid is important too, because we also want to talk to people who are unable to meet to the conference. So in person, so maybe in a hybrid way. So I think this is a good start, having it at a webinar level and then moving on.
Good idea.
Yeah, students came from different quotas, like state quota and different classes, communities. Yes. So some students may be on a scholarship here, maybe of a different have different motivations and background.
Anmika, did you want to add something? Anamika, before we end, you can have the last word here.
It was just my experience, like it reminded me of my MPhil days. And like there was very less studies I came across in this like peer relationship in the university. And that was really not a thing. Everything is about the clients and the caregivers, nothing about the clinician leave peers or students. So like it 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 really, this webinar gave an idea how important it is to make the groundwork from the study time itself. Like how you said, you suggested that kindness could be one like ground for everyone, as like as brainstorming to uh, to make the peers come at one ground beyond the quotas, communities, or culture. So that way. So, and for us, even in that time, we were 23, 24, but still we have to make silence. We are not supposed to talk without asking the professors. So I cannot, like, this time is completely different. So going back to that time, it feels like if we can go and redo the things, or maybe with our students, we can do those things. Not only in multicultural, even being in one country, we are from the different part of the countries, and we face those things which you're telling about the multicultural aspects or the diverse population. So it tells how much work we have to do.
Yeah.
Yes. So even apparently we thought that it's from one culture, but actually it is not. There are a lot of differences. And speaking about peer relationship, we actually also had studies comparing peers and supervisors, and there's the lack of evaluative concerns among peers really contribute something unique to the training experience. So we have some studies to show that they contribute differently to different training outcomes in terms of peers contributing to something and then supervisors contributing to something else. So
we reached the end. It seems like just the beginning of some discussion, but I hope we'll have more to follow. Thanks a lot for leaving us with all these thoughts and ideas. And yeah, we'll keep talking and meeting in Osaka. Thank you.
Thank you.
Thank you, Harold.
Thank you. My pleasure.